I would love to kind of walk through a timeline of the evolution of Hansei. May is a very special month, May 2026, because it marks our 10-year anniversary. And I often think about it that when I started the business, I just did the very next indicated action. I never considered in my wildest dreams that 10 years later that I would be a mother, that I would be a wife, that I would live in Nashville, and that we would be servicing over 30,000 patients a year and helping them with their benefits.
My name is Patrick. I'm the Chief Strategy Officer at Hansei Solutions, and I'm in long-term recovery. In 2016, Aaron started Hansei with a friend for his treatment center in Orange County. Same friend is who introduced me to Aaron in 2021. Her goal was to change the trajectory of Hansei by expanding the brand nationwide.
So how Hansei came to be was I had moved to California. I was 26 years old. I was living with my parents and going nowhere fast. And I had a friend who offered me the opportunity to move to California and basically start over. So I did that. And he happened to own an intensive outpatient treatment center. We'd been very close friends since high school. About a year into my stay in California, he said, "You know what, Aaron? I don't know what I'm going to get paid every day. I just go to the mailbox and I say a little prayer and I hope that there's money in the mail." And I said, "Well, let me go ahead and take a look at the processes." He said, "Aaron, you are the only person I know good at Excel." And I chuckled because yes, I am good at Excel, but I'm actually a process engineer. So more than Excel, I would be able to run a Kaizen event and kind of see where his revenue cycle process was breaking down. So I did a one-day event, very traditional systems engineering with the Post-it notes. We mapped out the entire RCM process. Everybody in the group identified where the breakdowns were. And what I learned from that is that they had no idea how much money they were earning from day to day. They knew who they were treating, but they didn't know what level of care they were in. They didn't know how much they were earning based on that patient's day. They had no idea when they would get paid. And they were faxing paper medical records to their third-party revenue cycle management company. And I looked at him and I said, "This is bananas. Like, you could do it better yourself." And I thought for a second, he can't do it better himself, but I could do it better for him. So it was at that time that I sought out to learn everything that I could about behavioral health revenue cycle management, specifically for freestanding facilities.
When I learned about Aaron's company, I said, well, in my experience, it really helps for a company to be scalable before you try to scale it. Personally, I've done it right and I've also done it wrong. So I said, why don't I, let me learn about Hansei for a month or so and to see if this is something that I really think I can help with. And in that month, I learned about the operating systems. I learned about their functionality. I learned about the workflows. And I was convinced it was something that together that we could really grow and expand. So I jumped on board in the beginning of 2021, and it's been quite the ride ever since. We went from just California to nationwide, the largest behavioral health facility-based revenue cycle company.
My name is Gail. I'm the Chief People Officer at Hansei Solutions, and I've been here since 2017. I was working in direct client care for about 10 years, and I had just started a family, and working 80 hours a week was not conducive to raising a family. And my ex-husband introduced me to one of Aaron's friends who said Aaron had started this company and was looking for someone to work there. I met up with her and I really knew nothing about utilization review or revenue cycle management, and she took a chance on me.
Hi, I'm Alexis. I am the VP of Client Success at Hansei Solutions. I oversee account management, aka client delivery executives, the contracting and credentialing departments, and the onboarding departments at Hansei. I was working with Aaron at the time. I was doing everything, VOBs all the way to AR, contracting, credentialing, joint commission, etc. Aaron had parted ways with this facility that I was working with to go and create Hansei. There were multiple times where Aaron had asked me, come to Hansei, come to Hansei. I was hesitant moving to Hansei because change is scary. To be honest, I lacked the confidence in myself. In the time that Aaron had first asked me to move to Hansei, versus where Hansei had grown when I actually eventually did move there. I didn't know if I had the appropriate skill set, but when I actually did transition over to Hansei, I realized that I had gained that confidence, and then I've just taken off from there.
I was looking for the manual. Like, I saw high and low. I even went to the library. I looked at the Medicare websites. I was looking at cms.gov. I was going high and low looking for where the rules were. There had to be a set of rules. There had to be a set of standards that outlined exactly what and how to bill for behavioral health freestanding revenue cycle management. And I was unable to find those standards. So I began building them myself. I put together a little consulting company, and I wholeheartedly believed that the people who were doing it in-house would have better overall outcomes because they knew their patients better. They'd be able to get better authorizations. They had more insight into their clinical care, and they just had more skin in the game. So I went around California, up and down the coast, and I did about a dozen projects teaching people how to bill themselves. And I thought, this is the way to do it. I had a 12-week curriculum. I refined it after each project. And then one day, I'll never forget, it was spring of 2016, I got a phone call. My phone rang first thing in the morning. Erin. I said, hello? They said, you won't believe it. My Anthem payments went down to $250 a day for IOP. I said, what? They were like, yesterday, it was paying 45.87% of billed charges. And I was like, oh my gosh. Then I got another phone call. Erin, my PHP payments, they've changed with Anthem of California. Then I got another phone call and another phone call. And shortly thereafter, there was a broad audit that plagued the freestanding behavioral health industry in California, and everyone who was around back then will remember it as the Health Net audit. The combination of those two factors taught me that there was a big oversight in my business plan, and that was that nobody was able to learn from the broader data. People were learning these things one at a time as their single EOB processed. There wasn't a big data set. I also learned as people left that the internal processes and systems I had set up, although there was an SOP, the teams were tiny, so they were very human-centric. So therefore, if you had a single UR person or a single billing manager leave or have an accident or need to, take FMLA, that was a single point of failure in the system. And suddenly the voice of the customer shifted and they said, you know what, Erin? I'm done with all this insurance stuff. We're good at helping people get sober. We're good at helping them with their mental health diagnoses. Can you just do it for us instead of teaching us how to do it? And that was the inception of Hansei Solutions. And that was exactly 10 years ago in May of 2016.
We focus on making our internal culture at Hansei, showing it to people external. So we really spend a lot of time and effort in our culture. Erin and Gail and Carly that works on my team really focus really hard. But what we want people to know is we are people that very often are in or have a family member that's in recovery. We believe in recovery. And everything we do at Hansei is to help providers help people access treatment and recovery. It really aligns, Hansei is really aligned with my personal mission of being in recovery and helping other people access it. And so it's been very rewarding. So over the years, we've really just focused on showing people that we're the expert and just sharing knowledge. Behavioral health is really hard. Working in behavioral health is hard. Access to behavioral health is hard. Insurance in behavioral health, both commercial and Medicaid, has never been harder to navigate and collect. And so, our goal is to help kind of ease that pain of being able to, access treatment, to be able to bill and collect in treatment, and to be able to help more people. That's part of the Hansei story, and I'm very glad to have, a little part of it.
The thing that drew me to working in treatment is I wanted to help people the way people had helped me. But like I said, it was draining. It was less rewarding than fulfilling most of the time, but working in utilization review, it was fulfilling because I got to fight for the clients, I got to read through their charts, I got to make a difference. And it's such a crazy thing because I went from working with clients for 10 years directly to doing this behind the scenes work. The clients never knew my name, never met me, but I knew everything about them, and I was the reason, if you will, that they were getting treatment because I was fighting for them on the back end. And I kind of felt like a firefighter, like I'm doing all this behind the scenes work that people don't know about it. And it was really special getting to tell these people's stories to clinicians and fight for more days and fight for them to get treatment. And really just, there's such a stigma around mental health in the insurance industry, and it felt good to be making a difference. So our mission at Hansei since day one has stayed the same, and that's advocacy and getting fair help and fair treatment for people suffering from mental health or substance abuse problems. And I feel like even as we've grown, we've always stayed true to those core values. Advocacy was one of the biggest draws at Hansei for me as someone in recovery, and making sure that people get fair treatment. One of the other things that I loved about Hansei was that it was a woman-founded company. And in those early days, we were women-owned and operated. But one of the things I really take pride in is 86% of our employees are women. I think 67% of those women are moms. About 75% of those moms are single moms. And I'm a single mom, and that's a really tough job. And one of the things that I have prided myself in is we know that you need some work-life flexibility. The culture we've built makes us trust the teams that we've hired. I love for myself that I can go pick up my kids from school and I don't have to worry that my job is in jeopardy. And I don't have to ask anyone that. And I don't want our employees to ask us that either. I want them to feel comfortable doing that and having a job. So as Hansei grows, my mission is to keep our same values we had as from day one, and keep the mission that I came in with on day one when Aaron was, hey, you want to do HR? And I was like, I'm your worst candidate, you know? And that is that if our employees are happy, then our clients are going to be happy. So that has always been one of the most important things to me.
As a CEO of a business, you lose optionality. I don't have the option to quit my job. I can't just say, you know what, guys, I think I want to go start a coffee business in Costa Rica. Sounds nice, but I can't do it. I have an obligation and a duty to the people, to our clients, to the patients, and to our employees. And I'm married to this business. Those are the types of things that I had never forecasted or that I couldn't have anticipated. I didn't anticipate how hard it would be when I took my first business trip when my son was 8 weeks old, and I had my phone with me, and the baby monitor alarm or notification went off, and I opened up the notification and I could see him crying in his bassinet. And I was in Texas and he was in LA, and he was just a newborn. He was only 8 weeks old, and I felt so powerless, like that I couldn't be there with my son. And I cried, but it hasn't been easy. When you run a business, and when you're a mother, and when you're a spouse, and when you have friends, and when you have your own hobbies and interests and values as a family, balancing that with running and growing a business can be really challenging. But it's been really hard to make that evolution, and I know that I'm not there yet. I know that it's a work in progress. And I think that as a leader, showing up every day and letting people know that I'm a human and that I have that vulnerability is important, because I am a human. We're all humans, and we're all just doing our best. And I want other people to know that they too can show up authentically because we spend so much time working together. The people that I work with are my closest pals. I spend more time with them than anyone else. And if I can show up authentically and say, guys, I'm having a hard day because I just had a bunch of dental work done, or I'm having a hard day because, my son is having a tough time with his speech development, or I'm having a hard time because it's challenging to be in a marriage while you're working 60 hours a week and traveling all the time, and it's hard to spread yourself and give attention to others. Or I'm having a hard time because I haven't been able to exercise, and exercising is a huge part of taking care of my own mental health. Then that lets other people know that they too can show up authentically. And as a leader, I want to make sure that I'm leading by example and that I'm leading through service.
What I would tell my past self right before I jumped in at Hansei is to lean into the uncomfort. Growth doesn't happen when you're comfortable, and I now lean into the discomfort every single day because I know that I'm only going to get stronger or smarter, or just at a minimum get more life experience. It's not a scary thing, it's actually really great.
Erin took a chance on me. She started me as the UR manager, even though I had never done UR before. We had the URs training me on doing UR as their manager. And I went away for maternity leave in late 2018. And in 2019, Erin gave me a call and she said, hey, we're bringing HR in-house. You want to come back as our director of HR? And I was like, I don't know anything about HR, Erin. And in my head, I'm like, I'm probably the most inappropriate person to be HR. And Erin was like, it's okay. We think you'll be great at it. We're going to send you to school. And so I went, and what I found is my personality mixed with HR was actually a really great recipe. What was really cool is I had worked in all these jobs for years and years and years where I loved the job, but I didn't love the leadership, or I loved the leadership, but I didn't love the job. And I got to build the company culture exactly the way I wanted it. And that's something I probably take the most pride in. I feel like I really have established the Hansei company culture and made it a place that I would want to come to work. And then, the subject matter we're dealing with is heavy, and there would be really heavy days when we'd be calling in a review for a patient or a client that was in a lot of pain, and the insurance company would be like, no. We have to bring some levity because it is a hard job, so we laughed a lot. If we didn't laugh, we would be crying, So Hansei gives people chances. This company was built by people in recovery, and as a result of that, we have a lot of employees themselves that are in recovery, and I myself have been given 3rd, 4th, 64th chances. Erin took a huge risk on me and continued to take risks on me as she brought me up through the ranks of the company. And it's always been near and dear to Erin's and my heart to extend that same courtesy mantra, if you will, to our employees.
We talk about this often. We're pretty organized in our scheduling and our planning, our 1 year, our 3 year, and our 5 year plan, and we've hit those plans. When it came to number, a big part of that is the brand recognition of when someone thinks about behavioral health billing, they think about Hansei as the expert. We are the expert, and people think of us as the expert, and that's been a very important goal. And I think what comes with that also is a responsibility to be an ethical provider, to share that information to both our customers, to people that aren't customers, right? To help them improve and navigate these very, muddy, rough waters of insurance and collections. Our ability with the team and Carly and JC of being able to have, podcasts and webinars and blogs that freely give out that information to help move the needle for anybody that works in this space has been what has really helped me believe that we've surpassed our goal. Of the space has really shifted in this last year. There's a lot of changes in appeals and denials, a lot of shifting in the payers and the requirements, and so it's never been more important to be able to give that information to providers as a whole. And we hope that we can continue to do that.
When I think about Hansei and I think about the future, what excites me the most is solving complex problems. What excites me the most is that we have a blank canvas in terms of what we can do with our team, with our talent, with technology, with partnerships, and being able to really revolutionize things. Founders generally are not motivated by money. They're motivated by winning. And when we look for people who are good for our team, I'm looking for them to have a few key traits. One, they need to be teachable. We're always learning every day. We never have all the answers. Number two, they have to have a relentless desire to win. And number three, grit. The people we work with, we've got motors. And I've never seen motors or grit like the people that we have on our team. So those three traits, remaining teachable, having humility, having the grit and the motivation and the ambition, and having a relentless desire to win, and having people surround me who carry those traits make me most excited, because I believe that we can revolutionize healthcare. I believe that what we do at Hansei can be done in other verticals. I believe that we can change regulation to make mental health care and substance use treatment available to even more people. I believe that we can create more equity. I believe that we can enforce mental health parity, but really being able to look into the future and think about that revolution and think about what exists in that blank canvas is what excites me the most. It's not about profit. It's not about more. It's about change, and it's about solving complex problems.